Damn, I can't think of what to record. Wait. Hi. Hi. Seeing as I covered Wellbutrin in the last video, I figure I might as well cover my other medication, which would be Lamictal, or Lamotrigine for the generic name. It is classified as an anticonvulsant and was originally FDA approved for use in preventing seizures in epilepsy. However, in more recent years, it has been FDA approved for mood stabilization and bipolar disorder. Lamictal also has off-label uses for BPD, schizoaffective disorder, OCD, anxiety, and treatment of some neuropathic pain, and there's a few others as well, but they're less common. The drug primarily works by binding to voltage-gated sodium channels in the brain, thereby reducing the release of aspartate and glutamate, and the reduction of those two excitatory neurotransmitters essentially calms overactive brain signaling. The primary effect of lamotrigine is that it is effective in preventing the reoccurrence of depressive episodes and making them harder to fall into. Now, for bipolar patients, you can have your manic episodes, hypomania, or depressive episodes. Lamictal does not really have much efficacy for the treatment of manic and hypomanic symptoms. However, it is quite effective at preventing the recurrence of depressive episodes in bipolar and just depression in general. It's a great drug overall, and I do believe that it has worked very well. However, whenever you do start Lamictal, it has a complicated process that you have to follow, as if you increase the dosage too quickly, you can not very easily, it is quite rare, but there is the chance of developing a life-threatening rash if you just immediately start jumping up in dosage. Other lesser side effects of Lamictal can be things such as headaches, nausea, dizziness, tiredness, but it's really just the typical side effects that most drugs would have. There can be some cognitive slowing for some people that are trouble with memory, and that would be due to the fact that it is effectively reducing how fast your brain is firing. Overall, I believe it has helped me, and if it works for you, that is what matters. I hope you found it at least a little bit interesting. Anyway, see ya.